So in this PowerPoint, we're going to talk about oncology. It's not the nicest PowerPoint to talk about because we're usually talking about cancers, and cancers aren't always the greatest outcomes. They can have some good outcomes from time to time, but um, cancer is not really a great fun thing to work with. So with oncology, what is cancer? We got to start with cancer first. So it's unrestrained growth of cells that destroy normal tissues and body parts. Can be very common in some instances, depending on the type of cancer. Serious disease that can be curable. That we'll just put that out there that it is curable in some cases. Sometimes it is not curable. We have to be aware of that. Cancer also has the ability to travel from one part of the body to another distant part via the blood or lymphatics. So this is called metastasis. And so, say I had a mass on the back leg, those cancer cells can actually travel all the way up into the lung tissue. So, via blood or lymphatics here. So, causes of cancer, there's a bunch of different causes of cancer. Genetics are going to be a big one. For some reason, golden retrievers, boxers, Rottweilers, and German shepherds are notorious for going to have for having cancer. So, why? There's just something in their genetic makeup says that they are really prone to acquiring cancer, whether it's osteosarcoma, lymphoma, um, mast cell tumors, things like that. So these just guys, it's unfortunately it's in their DNA. With spaying and neutering, this reduces the chances against mammary tumors and also reduces the risk of testicular or prostatic cancers in male dogs. So dogs and cats can also get mammary cancer, just like people, so they can get breast cancer. Sometimes they can be benign, which that means they don't spread and they'll just kind of sit there. Sometimes they're really aggressive cancers, they can spread all over the body. Same thing with testicular cancer and prostatic cancer. It is easier to just, you know, remove these. They're usually hormone based, and so if we just get rid of them, um, get rid of that source of hormones, then we won't have these problems either. Environmental contaminants, like if we're talking about like cancer-causing drugs or cancer-causing like hazardous materials, those can also be a factor. Usually not as much as some of these other guys for our dogs and cats. So how we diagnose cancers. So we're going to do a fine needle aspirate, FNA or a cytology. So we're going to stick a needle into that mass or say a possible cancer site and pull cells out of there and look at them under a microscope to see if they look like they're cancerous or not. Biopsies are histopathology, so we'll take that mass off, or we'll take a sample of it. We'll send it to a lab, and they can tell us, yes, this is cancer. No, this isn't. This is what kind of cancer it is. Did you get all of the cancer? Things like that. Radiographs, if we're talking about like osteosarcoma, which we'll talk about, if cancer is infiltrated to the bone, things like that. Blood work is always essential because we want to make sure that, say, if they had like a lymphoma or something, if we see an acceleration or increase in lymphocytes, that would be indicative of lymphoma. So treatment for cancer patients, quality of life is number one goal of treatment. So depending on what type of cancer they have, making sure that these pets are comfortable at all times because cancer can be very painful for these critters. Depending on what type it is. If it's like a small little mass, like a mast cell tumor, usually their quality of life is pretty good. If we're talking like osteosarcoma, where it's eating straight into the bone, that is very, very, very painful. And so we have to make sure that they are, still enjoying life. Palatation, so if it is food, making sure that they're eating, drinking, things like that, things that are palatable for them. Tumor control, making sure that tumor doesn't get any bigger, or making sure that it does go down, things like that. Remission versus curing at any cost. So not again, all of our cancers are curative, and so we can put cancer into remission. Remission just means like kind of a suspended state. It doesn't mean that it's gone forever. It has a possibility of coming back, but for the time being, it's kind of like asleep or in that suspended state. Um, and so this is sometimes a little bit more achievable goals than it would be at curing at any cost, depending on the patient, depending on the client as well. There are three common treatment methods, very similar to people as well: surgery, radiation, and chemotherapy. Chemotherapy is going to be with drugs. For surgery, method is most likely to cure if the tumor is localized. So, like, if it's a small little mass on the leg or on their back, on their ear, on their face, on their tongue, wherever, first surgery has the best chance of cure. So we take it out. We take out these big margins. Like, say, if it's a pea size, we're going to take about a golf ball size, just to make sure we get all that cancer cell out of there. Radiation can be used alone or in combination with surgery and chemotherapy to treat local disease. With radiation therapy, most often used to treat smaller tumors, um, can be curative or palliative form of treatment. So just depending on what type of cancer it is, if it's like can be killed with radiation, great, awesome, then you have to do surgery. The goal of it is to destroy reproductive capability of tumor cells without the excess damage to surrounding tissues. So we have to be just aware of that. Again, it doesn't always kill all cancer cells, but in a combination with like chemotherapy and if surgery is not an option, this is kind of a really good combination with that. With chemotherapy, this is going to treat cancer systemically, so most effective against rapidly growing tumors or masses. So if we have stuff that's moving really fast throughout the body, we're going to try to, hit it hard and fast from the inside out. There are some major side effects to that. Most are self-limiting and resolve with minimal intervention. So um, we just give them the chemotherapy and boom, it's gone, which is great. If these animals can't, handle surgery or radiation, things like that, it definitely we can see also radiation and surgery, depending on where the tumor is located, depending on where the patient and where the client are located as well. A lot of big radiation units are not in local areas. I mean, now we're starting to see a lot more. And there are some cases like they have to go to like university settings, like Washington State University, all the way in Pullman. So just we have to be aware of that as well. Chemotherapy is a little bit more easily accessible. Um, there's a lot of oncologists in the Puget Sound, which is great as well. So on the chemotherapy, usually begin 3 to 5 days post-treatment. Less than 5% of patients require actual hospitalization. So that's either like in a capsule form, tablet form, or they come in for an injection or an infusion and then they leave. Less than 1% mortality rate. And so these guys are very, we don't see animals dying from the chemotherapy per se. We see them, usually passing from something else. Myelosuppression, we can see. So this is suppression of the myelos. Gastrointestinal toxicity, so we can see a lot of irritation with the GI tract. Hypersensitivity reactions, so these animals can kind of go, not into like full-blown shocky, but they can get hypersensitive to like other drugs and things like that. We can also see hair and coat changes, kind of like people. People, they usually lose people will lose all their hair. We can see like coat loss, or we can see just like change in quality of their coats of these animals as well. So when we start chemotherapy, a CBC is required before chemotherapy is administered. Blood is collected via the jugular vein puncture because we need all of their other vessels in order to administer the drug. So also when we're administering these drugs, extreme precautions should be taken place when handling, preparing, administering, and disposal of these drugs and or waste. You always want to use appropriate PPE because these drugs are meant to actually destroy cells. And so if they're meant to destroy cells, then cancer cells, they're going to destroy the cells on your body as well. And so we have to be very, very careful of that. And they can also cause they're not going to cause cancer, but again, they're going to kind of destroy any, viable living tissue. Large amounts of saline flesh should be administered before and after administration to ensure patency. So that makes sure all the drug is given and nothing's like, possibly going to leak out of a catheter site or a vessel. Drugs given as an IV bolus or IV infusion, depending on which drug is being administered. So usually we can give it as an IV drip, and we always just want to make sure that we flush it all the way through when they're done. Um, Cyclophosphamide, I'm not super familiar with a lot of the oncology drugs just because in general private practice we don't usually use it a ton. Every once in a while we will use it, but not very often. You don't need to necessarily know all the different types of oncology drugs, and so we have to be aware of just be aware of that. So cytotoxin, so this is a type of injectable um, medication. Oh, excuse me, not injectable. They're tablets that we can just send home with the owner. We're going to give them for 4 consecutive days a week. Usually it's like on a week, off a week, on a week, off a week. So that way we don't kind of mess up the entire body. Doxorubicin, I've used this before. We had my doctor used it once in my clinic. It's a little freaky to use it because none of us had never really used it before. But the animal did really well. Adriamycin, aka Red Death, is used to fight many forms of cancer. This dog had lymphoma, so they were giving it this. We give it a slow IV administration, so that animal was kind of hospitalized with us um, for like a couple hours. Then it went home during the day, and then or after that, and then would come, every 2 to 3 weeks. So, um, yeah, we had to take some proper precautions to dispose of it, but other than that, it was pretty straightforward. Vincristine, Oncovin, or Viniscar. I've never used this one before. This is another type of injectable. Uh, Lumustin, CNUN, or CCNU. I think this is for lymphoma, if I am correct. Maybe. Not exactly sure. Extravasation injury. So this is the accidental delivery of substance outside the blood vessel into the surrounding subcutaneous tissue. So we have to be very, very careful when we're again administering these drugs. Most of the time, a technician or a doctor is going to administer these drugs. So we have to be aware which drugs are extravasation risks, but the best practice is to treat all chemotherapy drugs as risk. What can happen is that injury can ranges from local pain and discomfort to tissue damage, moist dermatitis, and actually extreme cases, the skin will actually slough off and die because, again, we're killing tissues. And so it's really, really gnarly. You have to be careful of that. So when we can see this happen, we can see it happen like 1 to 10 days following extravasation. So whether it's like, the next day or it can be like days later that we actually seen this happen. Full extent of the injury may not be even visible for several weeks. So we might not even see that some of this drug got out of the vessel until like weeks later, like if their skin starts sloughing off. So have to be very, very careful with this stuff. So here's an example of that. So day 14 after the drug was administered, and then this is day 28. So this is cleaned up a little bit more, but that tissue is still exposed, and it's better than this. Day 28, you're like, oh god, that looks terrible. It is still better than this. So 35, 49, it's still healing weeks later. Finally, day 63, we're very small now, and that's all going to scar over, and the hair might not grow back the same either. So just be aware of that if you ever have to administer chemotherapy drugs. So irritants. So these are drugs that can cause irritation. Vesicants. These are kind of like the what is it? Like the buffer agent for it, so to help kind of reduce that. Um, with the extravasation treatment, if left undetected, an untreated injury can be quite extensive. Again, we can see a lot of tissue necrosis and damage there. Delayed sloughs require bandage changes, antibiotics, pain management, and anti-inflammatories. Doxorubicin or adriamycin causes tissue necrosis so severe it may spread and expose muscle, tendons, and bones. We would have to ice the limb as well if it's not doing any well. We have to be very careful with that. If these drugs come out of the vessel, viscotrine and vinblastine, we're going to warm compress them every 15 minutes, every 6 hours for 24 hours. So in order to try to save that. The common cancers that we usually see are lymphoma and osteosarcoma. These are our two kind of bigger ones that we see. So lymphoma is malignant proliferation of lymphocytes. So we see a lot of these lymphocytes all over the place. Aspiration of a lymph node for cytology confirmation. So we're going to poke one of our lymph nodes if we see it swelling for any reason in order to make sure that we have it or we don't have it. These are 5 different spots that we can aspirate depending on where it is. The goal of lymphoma treatment is to get these guys in to achieve clinical remission. So that's 60 to 90% of these animals can get into remission as well. The treatment for it is about 9 months to a year. If left untreated, sometimes these animals have 2 months or less to live, unfortunately. There is a Madison protocol is an example of a what is this here? So that CHOP is a multi-drug protocol in order for us to better fight off and put these cancer patients into remission. So CHOP protocol combines all these different chemotherapy drugs, a steroid, and a steroid as well. So CBC should be performed prior to each chemotherapy treatment just to make sure that CBC levels lymphocyte levels are at an adequate level if they still need to treat it or not. So we always just have to make sure of that. Otherwise, we don't want to give them extra all this chemotherapy for no reason. Osteosarcoma is most common primary bone tumor in dogs. It's a malignant mesenchymal tumor of the bone cells. We usually see this kind of at the ends of our long bones, so like the femur and the humerus. Common in large breeds like our Rottweiler, Great Dane, and Doberman Pinscher. It's just in their genetics for some reason. They usually present with lameness and swelling at the primary site, most commonly on that limb there. And so osteoblasts are continuously growing cells that are that have a large nucleus appearing to protrude from the end of the cell here. So these guys, these are all osteoblasts right here. And they just keep multiplying, multiplying, multiplying. These are all red blood cells that are smashed together here, these red guys. So staging of osteosarcoma, radiographs of an affected leg for confirmation. We usually see it's usually hot too, swelling. We do a 3-view thoracic radiograph, regional lymph node evaluation, a CBC, a chemistry to evaluate blood cell count. Chemistry is going to now analyze organ function, and a urinalysis to make sure that there's nothing going on in the urinary tract. The reason why we do 3 radiographs of the chest cavity is that a lot of our cancers, they migrate to the easiest, softest, squishy spot possible, and that is the lungs. So when we see metastasis, that the first place that they're usually going to go is into the lungs, and then they'll start going into other organs as well. We're going to look for elevated alkaline phosphate levels. Alk phos is going to be in our liver, are associated with a poor proper prognosis. So here's an example of osteosarcoma. So this is our tumor right here. This is what the bone should normally look like, but you can see that this mass is just eating away the bone here on both legs there. How we can treat osteosarcoma is amputation of the affected limb to alleviate source of pain and maximize mobility of the life. What we see happen with a lot of these dogs that have these tumors here is that they're so fragile and barely hung together and that they break super quickly. And so very, very painful for these dogs. Cats we don't really see osteosarcoma with very often. We'll see lymphoma more in cats. With our dogs, 90% will die with metastatic disease, usually in the lungs within 1 year, when amputation is the only treatment. These guys, again, are usually going to get radiation or chemotherapy on top of that amputation. So you just have to be careful of it. Dogs can live without 3 legs. They can live without a front leg. They can live without a back leg just as fine. Sometimes they usually have a little bit more arthritis issues. We can see it pop up again into the lung tissue. We can see it pop up on another leg. So just be aware of that. So here's an example of lungs that have metastasis. So they're called METs. So this big guy right here in the middle is the heart. The lung is this big kind of triangular space. Oh wait, I have a little drawing tool. So here's our heart right here, this big guy. Our lungs are going to be this large triangular space here. And then each of these round nodules on the lungs are cancer. So they're all over the place. It doesn't allow the lungs to expand very well. It doesn't allow them to breathe very well. And so once it's getting this stage when they're really, really big, it's a very poor prognosis from there. And so usually humane euthanasia is elected for that as well. Um, So we can, other treatments that we'll use, chemotherapy following the amputation can slow the growth of metastasis and improve life expectancy. Approximately 45% of dogs live over 1 year when treated with adjuvant chemotherapy. So if they're getting chemotherapy on top of that leg amputation, then they're definitely going to then they're going to have a better chance at life. Two most effective agents that are used are carboplatin and adriamycin. These are really commonly used for osteosarcoma treatment. When the owner elects not to amputate and chooses palliative options, so if surgery is not an option for that animal, say if it's like a really old animal, or if it's like a large animal that wouldn't do well without um, out its forelimbs, then they can do a palliative care. NSAIDs can be helpful for pain relief. Priocoxam, Rimadyl, Darimax. We can also use opioids as well. Tramadol is not really commonly used as much right now, just because we're seeing that animals don't process it very well. It's more of a pain management for people. Going back on this, there are some studies that are going around right now that they are developing a osteosarcoma vaccine as well. It's not a preventative vaccine like we would think most vaccines are, but it's a vaccine that it's not a chemotherapy, and um, it's kind of like a stem cell, kind of not, in order to help keep these animals in remission if they have had osteosarcoma, say they had the leg amputation and everything. And so hopefully there are some of those going into trial as we speak, which is pretty awesome as well. And that's that.